Why do diuretics work differently for edema in CKD patients? Imagine trying to drain a bathtub that has a slow leak. You might need a different approach than if the drain was fully open. That's similar to how diuretics work in people with chronic kidney disease. When the kidneys are not functioning well, their ability to filter and handle sodium and water gets impaired. This means that the usual way diuretics help reduce swelling or edema doesn't work as effectively. In healthy kidneys, diuretics block sodium reabsorption at specific parts of the nephron, the tiny filtering unit. But in CKD, the kidney's filtering capacity drops, usually measured by the glomerular filtration rate. When this rate is lower, less sodium is filtered into the urine. Since diuretics depend on delivering sodium to their sites of action, less sodium means they can't work as well. This often leads to what doctors call diuretic resistance, where higher doses or combinations of different diuretics are needed to get the same effect. Different diuretics act on different parts of the nephron. Thiazide diuretics work on the distal tubules and are generally effective when the glomerular filtration rate is above 30 milliliters per minute per 1.73 square meters, which is typical in early stages of CKD. Loop diuretics, like furosemide, act on the thick ascending limb of the loop of Renal and are preferred in more advanced CKD when the filtration rate drops below that level. Potassium-sparing diuretics act on the collecting ducts, but are used cautiously because they can cause high potassium levels, which are risky in CKD. In CKD, the response to diuretics shifts. You need larger doses to get sodium and water to leave the body because the kidney adapts by reabsorbing more sodium downstream from where the diuretic acts. Plus, reduced blood flow to the kidneys can limit how much of the drug reaches its target, making it harder for the medication to work effectively. This is why managing edema in CKD often requires careful dose adjustments and sometimes combining different types of diuretics. There are also risks to consider. Diuretics can cause electrolyte imbalances, like low potassium or high potassium, and can sometimes temporarily decrease kidney function further. That's why close monitoring of kidney function and electrolytes is essential when using these medications in CKD patients. Ultimately, managing edema in CKD is a balancing act. Diuretics are vital for relieving symptoms and controlling blood pressure, but their effectiveness depends on the stage of kidney disease and individual response. Early in CKD, thiazides might work well, but in more advanced stages, loop diuretics are usually necessary. Sometimes doctors combine different diuretics to overcome resistance. The key is personalized treatment, with regular checkups to ensure kidney health and electrolyte balance are maintained. Always remember, anyone with CKD should work closely with their healthcare team to find the safest and most effective way to manage fluid retention.